Hello, my name is Lynn Posberg. I'm Evelyn Mackin's daughter-in-law, and I know that she would be very honored and deeply humbled to receive this very prestigious award. I can tell you that therapy was a lifelong passion for my mother-in-law. She was a young girl in the 1930s reading a magazine, and the cover of the magazine had adults in a pool working with children. And she was curious enough that she wrote to the magazine and wanted to know what they were doing. And the response was that they were physical therapists who were working with children who had had polio. And that was the inspiration for her becoming a physical therapist.
I believe the first goals of ASHT really began during the 1975 annual meeting of the American Society for Surgery of the Hand. It was so great to meet with 5 other therapists in San Francisco who all shared my passion for treating hand and upper extremity patients. The 6 of us, who later became known as the founding members, were comprised of 2 physical therapists and 4 occupational therapists. OTs and PTs working closely together at that time was a novel idea of inclusion.
I'm the youngest sister of 3 daughters in our family, and we all became occupational therapists. And I remember as a teenager, when I was a teenager, her taking me on tours of the Hand Rehabilitation Center in Philadelphia and numerous visits to the U.S. Public Health Service Hospital for Hansen's disease in Carville, Louisiana. Even while I was in high school, she actually took me to the very first hand therapy meeting, which at that time was held in conjunction with the American Society for Surgery of the Hand.
I know that Mary would be very honored to receive this award. I believe she would say this award signifies the importance of ASHT, that this award represents the growth and success of the organization. I believe she would humbly say that this award is not about what she did as an individual, rather what the founders were able to accomplish together. Mary viewed achievement and progress as validation of the necessity of the work. I believe she would view this achievement the same way, as recognition of the value and necessity of the founder's original vision.
This award is very unexpected, and truly it's an appreciated honor. And the founding of ASHT was never an individual effort, but rather a dedicated endeavor by 6 strong women working under very stressful conditions who wouldn't even consider the overwhelming opposition, who said, no, you can't do that. This award to me means, oh, yes, we can, and obviously we did it well. Thank you for your confirmation by this award.
What does it mean to me? Well, it tells me that the society is alive and well and will be looking back at their past in order to feel good about the advancements that they have made and the progress they have made. I'm very honored, and I really think that it's a wonderful thing to know that something I created so long ago has value, credibility, and people respect the fact that we have come this far.
So at that pivotal American Society for Surgery of the Hand meeting in 1975, Mary and the other 5 founders saw a need, a direction that they believed they had to go as therapists. They were very clear about what they wanted. They wanted to establish hand and upper extremity therapy as a medical discipline. They wanted to recognize the role that occupational and physical therapists play in restoring patients' quality of life. And they wanted to develop standards of practice to ensure that patients receive the highest levels of care from hand and upper extremity therapists around the country. They had the support of the surgeons with whom they worked, but they also had critics that believed they couldn't or shouldn't do what they were doing. They didn't allow criticism or skepticism to limit them. They just pressed on because they believed in it. They had high standards for the work they were doing, and they believed these high standards should be the level to which all hand therapists should practice.
She certainly had mentors and teachers and colleagues that she learned from and that taught her throughout her career. And I think that's a lot of the reason why she was so willing to pass along her knowledge to other therapists or people that she worked with, because she knew how much she benefited from that. And she really, truly saw it all as just a big collaboration of specialties coming together to create this other specialty of hand therapy.
And many hand surgeons did not yet appreciate the therapist role in rehabilitation of the hand, but that was about to change, because if you ever met Judy, you would realize that she was very determined and never stopped if she had a goal. And I've met several of the founding hand therapists, and they were not stopping either.
The respect of this society and the profession of hand therapy today is to be commended. In my opinion, the respect has evolved because of the superiority in treatment techniques, advanced education, and research goals, which are being met by this society.
My vision for hand problems in the future would be that all patients would be directed to a qualified and certified hand therapist, regardless of where they live in the world and what the patient's economic status was. ASHT has facilitated that, and I hope that all therapists in the world in the future will be able to access the resources provided by ASHT, as well as the International Society.
Who my mother-in-law was as a person and a therapist, and why she devoted her career to hand therapy. She was always grateful and always caring, and more than anything, she wanted to help people. And I think that's ultimately what her entire career was about. Again, on behalf of Evelyn, myself, my two daughters, my late husband, Dr. Glenn Mackin, are very honored and very privileged to receive this award on her behalf.
If I can offer my advice to you, stay passionate and enthusiastic regarding your chosen profession and all that our society has to offer.
To be inducted into a Hall of Fame, you have to have made a phenomenal contribution to a field. All 6 of these therapists did just that. 43 years ago, hand therapy was just a brand new field. Now the path has been set thanks to these 6 insightful therapists and many who followed in their path. My words of wisdom would be to welcome new members, encourage one another, and just respect others' ideas and contributions. In closing, I truly loved my sister Judy, as well as Evelyn Mackin, one of the other founding members. We have lost pioneers, but what we have gained is remarkable and a path set for the future.
In a recent ASHT journal, I was so impressed with the innovations by this generation of hand therapists and the continuation of advancing the science and the practice of hand and upper extremity therapy through education and research. You really don't need any advice from me for the future, because you never lost sight of the goals that got us this far, and I feel confident that you will keep expanding that knowledge.
In her own words, they, quote, didn't realize the importance of what they were doing or the way it would grow. What can you do today that you will look back on in 1, 5, or 15 years and think to yourself that you didn't realize how important that was going to be? As a member of ASHT, you are called to reach for more in your personal and professional goals. You are meant to reach for more in your own potential for impact. Today, you get to use your voice and the things you can control to adapt to the circumstances of today, to support the mission and vision of ASHT, to grow the profession, and to lead your communities with strength and courage. Thank you for inviting me here on Mary's behalf.